Okay, I'm going to go ahead and get us started just to be respectful of everyone's time. Good evening, everyone, and thank you so much for joining us tonight. Our hope for you at the end of this discussion is that you receive valuable information and feel ready to engage in the next steps for your future family. My name is Olivia Rowland. I am a registered nurse and physician relations specialist for Donor Egg Bank USA. And I'm happy to introduce you to Heidi Hayes, our co-founder and vice president. Heidi is joining us tonight not only to discuss the process of using donor eggs, but also to share her personal story on how she used donor egg to complete her own family. We will be taking questions at the end of the presentation. There is a Q&A section here on Zoom for you to submit your questions, all of which are anonymous. So just to run through our objectives here, throughout this discussion, we will touch on coming to terms with the diagnosis. For many of you, sometimes this is the hardest step, and it's important to address that and face those common fears. We're going to talk about navigating the different emotions of using donor egg to complete your family, taking those first steps to choose a donor, mapping out your game plan and running through your different financial options, and then looking towards the future.
Thanks, Olivia. And I just want to say hello to everyone. We're so excited to have you join us. I see all these hellos, coming from the chat section. It's great to have you with us. I'm going to start out by telling you a little bit about myself, and I know some of you out there are going to be able to identify with my story. Everyone's journey is a little different. You're looking at a picture of a much younger version of my husband and myself. We, like everyone, got married. We stopped using birth control, and we just thought it would happen pretty quickly. We spent so much of at least me, I spent a lot of my time trying not to get pregnant. Here, when I wanted to get pregnant, I wasn't able to. So we started out with IVF, and it was not successful for us. We did a total of 11 cycles of IVF, and then we did 3 IUIs, and ultimately we decided to move on to an adoption. We just wanted to have a baby, and we were pretty emotionally exhausted from the process, and we were very financially drained. And we were told having an adoption would be a sure thing. We would be certain to be parents. And, true enough, we started that process. 2.5 years later, we brought home our son from Guatemala. We're at the airport. We're parents for the first time. We're absolutely elated. And so we decided, our family wasn't complete. We wanted baby number 2. And I really wanted a girl. So the adoption worked for us, whereas fertility treatment had failed. And we decided to go back to Guatemala and pick out our daughter. It was so exciting when we got the referral. If you don't know much about the adoption process, you pretty much get in the queue, you wait in line, and when ultimately there is a baby available, we got the call to say that there would be a baby available. We flew down to Guatemala to visit her. We saw her multiple times. My parents flew down, my aunt flew down. Like, we were in love with this baby. She was still in the process. We were going to have to wait for all the paperwork to be completed. But just like my son, we knew that eventually she would be ours, and we were so excited to know that our family was growing. And this photo is particularly poignant to me because this is the last time I ever saw her. It came as an absolutely crashing blow to lose this adoption. We tracked this adoption for 6 years. When she was 5 years old, we got a call from Homeland Security to be told that she would never be ours. The courts had determined that she would go back to a member of the birth family. We don't know who that was, and we don't know to this day. And I show you this picture because if you've gone the IVF route of this journey, you know how hard it is to hear you're not pregnant. We also had 2 miscarries in that journey, and I didn't think that I could stand after that. But nothing compared to the devastating blow we had after having a child in our arms, to lose that child. And it gave me a completely new perspective on ways and methods of becoming a parent. So we came to what I think of as the crossroads. You know, what do we do? And how do we navigate moving forward? What is the right decision to make? So I'm going to walk you through a little bit of our thought process. Again, this is our personal journey. Your journey will be different. Your circumstances are different from ours. Either you may have known that you've had a fertility challenge, or maybe you just recently have found out that you need to use donor egg, or maybe you are a same-sex couple and you've known you're going to use donor egg all along. But each of us has a journey. And when you think about adding a child to your family, you know, many of us look at all the different options available. At this point, the 2 most likely options are adoption and egg donation. So what are some of the things to consider? First of all, the costs are similar. With adoption, you have to pay for the home study, fingerprints, legal fees. If you're doing a domestic adoption, typically you're still going to use an agency. There is all the costs to market yourself. You have to create a life book. There are a lot of costs involved. Typically, an adoption will run around $40,000. 10 to 20% of birth moms will change their mind. It's not a sure thing. Some adoptions do fail. Many succeed. I have a wonderful son because of adoption, and I'm grateful for him and the process. When I went through IVF, I felt completely out of control. When I went through the adoption process, at first I felt in control because I could control my paperwork, but ultimately I felt out of control as I didn't know for 5 years, 6 years total, would we get our daughter? Would it come through for us? The wait time can be excruciating with adoption. When I looked at egg donation, I liked the fact that not only would I control the process by being able to choose the donor versus the donor choose me, I got to actually choose the donor. But I also know that once the embryo was transferred, I would know in 2 weeks' time. And that was really great for me to think about egg donation. When I weighed the 2, I also thought about the fact that I would be able to be pregnant. I could actually have that baby in me. And, you know, the donor gives me just 1 cell, and it's really my body that will make and weave that baby together. And that was really appealing. I also like the fact that I'd be able to bond with my baby in the uterus versus waiting after the adoption. It does take longer to bond with the baby, was my experience, many that I've talked to via adoption. But at the end of the day, you do bond, and that's really the most important part. Go ahead.
So let's take a look at the reasons for egg donation. Decreased ovarian function. This is a decrease in the quantity or quality of your eggs. Premature ovarian failure. This would be reduced function of your ovaries under the age of 40. And sometimes this can be related to genetic factors, or an issue that runs in your family, or even an autoimmune disorder. Failure of other fertility treatment types that you might not have had success in, or maybe you've gotten pregnant and have suffered a pregnancy loss. And Donor Egg Bank USA really is all encompassing with our servicing to the LGBTQ+ community. So why donor eggs work? Women are born with all the eggs we're ever going to have. And as we age, our ovarian reserve diminishes. Our peak fertility actually occurs sometime around between our 20s and early 30s. And after you hit 30, you do start to see a rapid decline beginning. So what we're looking at here is essentially that as we age, the rate for miscarriage increases. Most miscarriages occur because of a chromosomally abnormal pregnancy. And as you can see, the rate of that is increasing as we age. So what are some advantages of using frozen donor eggs? When you purchase a lot of eggs from Donor Egg Bank USA, you will be getting 5 to 8 mature eggs, and they're already retrieved and frozen and ready to be shipped. You may question why there isn't a fixed number of eggs in an egg lot, and that's because every woman provides mature eggs at different numbers. So we have an algorithm that we use to make sure that we're only using the best mature eggs. And when you look at a donor on our website, you will be able to see exactly how many eggs are coming in the egg lot from that donor. With frozen donor egg, there's no need to synchronize with the donor. So there's no chance of a donor dropping out during the process, during the screening and testing process, or of the donor maybe making a mistake with their medications. You have much more control of your cycle timing, and you can really begin when it's convenient for you. Another reason why it's great for surrogates. And you have a very wide donor selection. So currently we have over 300 donors available, very, very diverse possibilities for you to take a look at and choose what's best for you and your family. Overall, frozen donor egg is less expensive than a fresh cycle.
So Marsha Cross is truly a hero to me. And I love this quote from her about her children. She says, "I don't like the average woman being misled into thinking that fertility is something that goes on forever. When a woman gets older, they get donor eggs, which doesn't make the baby any less beautiful or perfect. One's own eggs only last so long." And I really love Marsha Cross because when you look at Hollywood and we see all these women and they're 50 plus and they're having these beautiful babies, what Olivia already showed us is that it's not true. Women get a donor egg. We're utilizing the beautiful, vibrant, healthy eggs of a younger woman that are less likely to result in a miscarry, less likely to be chromosomally abnormal, and more likely to give us a baby. So let's talk about the success rates for a moment, because at the end of the day, it's about bringing home the baby, right? I like to move people away from thinking about just getting pregnant and actually bringing home a baby. So we are very transparent with our success rates. What you see across that top line, transfers performed, are all of the egg lots that we ship out to 280 different fertility clinics. We do require those fertility clinics to report back their outcomes in order to utilize Donor Egg Bank USA. We have a reporting tool that they do that. And you can see that in 2020, we had 1,376 cycles that were performed, transfers. 6.8 eggs on average were thawed because we average between 5 and 8 eggs in the egg lot. The pregnancy rate was 71%. The clinical pregnancy rate is 61%. What is the difference? The clinical pregnancy rate means that they went in and they could see the gestational sac, and oftentimes, or most of the time, a heartbeat on the ultrasound. That's what a clinical pregnancy is. 69% of the time, there were excess embryos that were frozen for subsequent attempts. 13% miscarries in 2020. It's part of life. Unfortunately, it's natural. And 53% of those that had a transfer went on to actually have an ongoing pregnancy and a delivery based on the timing of that 2020. Let's see, it's now September. So all of them should be delivered by the end of this month. So we do keep real-time statistics. If there was any miscarries in the course of 2021, that will be reflected in our data as well.
All right, so let's talk a little bit about the process of choosing a donor. So all of our donors undergo very thorough screening. As you can see here, the list of different screening and testing that they all undergo. That includes genetic screening, a multi-generational family history, the medical history and fertility health history is assessed. All donors must be non-smoking. They go through that drug screening, infectious disease screening, and they all work with a mental health professional to go through psychological counseling as well. For those of you joining us from Canada, we know that there have recently been some changes in the Health Canada eligibilities for donors, but I can assure you that we have over 250 donors who are Canadian eligible as well. And just to give you an idea of really the thorough screening that all of these donors go through, and just how hard it is really to be fully approved. For every 100 applications that we get, only 1 to 2 donors on average will actually make it to retrieval.
So how do we go about selecting a donor? You know, I've been through this with my husband, so we know how difficult it can be. But the first word of advice I would have for you is enjoy the process. So, you know, make it something that when you do have children, and I do have children, by the way, you'll see them in a little bit. You know, I can tell them how exciting it was. We were so excited to take a look at the different donors and choose the one that we were going to use to have our precious children. We had a nice bottle of wine. We did drink the whole bottle, and we did look at all the donors on the database. So we had a great time. You have to only match the most important issues. There is no perfect mini you out there. And you can drive yourself crazy looking for the perfect donor. Look for what's important, but you're going to have to compromise on lesser issues. When you take a look at her education, look for the intellectual potential, not just the education level. You know, our desire to go to college, what we pursue in life are often reflective of our financial circumstances, the way we were raised, what was important to our parents. So look for that potential, not where she is right now. Remember, everyone has imperfections. You do as well. And then matching the blood type is not medically necessary. It's only necessary if you do not intend to ever tell your child that they were donor conceived. And on that note, I want to say that with the advent of the DNA banks like Ancestry.com, 23andMe, we highly recommend that you tell your child young, tell them often, make it just a normal part of their growing up process, because it is likely that there will be a day they will learn that they're donor conceived, and they may not learn it from you. They may learn it from one of these DNA banks.
All right, let's walk through the different financial options that you have through Donor Egg Bank USA. So starting us off is the single egg lot plan. With this plan, you are purchasing 1 egg lot for a cost of $14,500, and you receive an average of 5 to 8 mature eggs, and you're guaranteed at least 1 usable blastocyst. And if there is no good usable blastocyst, then you will get a replacement egg lot. With this plan, the treatment for the cost of treatment is paid separately to your clinic. And then we have the double egg lot plan. With this one, you are paying $27,500. So you can see there is a pretty significant discount on the additional egg lot. you will receive 2 egg lots of 5 to 8 mature eggs, and you will get a guarantee of 2 or more blastocyst embryos. And again, with this one, the treatment cost is paid separately to your fertility practice. And then we have the single cycle plan. So with this plan, we are actually combining the cost of the eggs with the cost of treatment. We work with your physician to decrease the cost of eggs and treatment and come up with a one-time upfront cost that is more reasonable for you. And with this plan, both of the eggs and the treatment are protected. So if for some reason the egg lot did not perform as we hoped and there is a canceled cycle, had you been in the single or the double egg lot plan, you may have to come up with payment again for another treatment. But with this plan, the treatment is guaranteed. And if in the case that there is a canceled cycle and you have to do another cycle with a new egg lot, you've already paid for that treatment cycle. The cost for this one does vary amongst clinics because each clinic has a different set value for their cost of treatment services. But if you contact us, we can certainly let you know what the cost would be for you at your chosen clinic.
So I asked Olivia if I could talk about the 100% assured refund plan because this plan is really near and dear to my heart. And it's a big part of what I wanted to accomplish when we started Donor Egg Bank USA. You know, after all the IVF cycles that I endured, and then the adoption, and then a failed adoption, we were pretty financially strapped. And I really needed to have a plan that would protect me financially, as well as just give me the assurance that either I'm going to have this baby or I'm going to have my money back. And so that's where the assured refund plan was born. It guarantees you will bring home a baby, or we're going to give you 100% refund of what you paid for that plan. It offers up to 6 treatment cycles, all covered by us. That includes all the frozen embryo transfer cycles that you might need. If at some point you decide you don't want to stay with the plan, you can go ahead and leave. You'll get a 50% refund. If for any reason in the process, we no longer believe in our heart that we can get you pregnant and successful to have a baby, we will give you 100% of your money back. So you do have to provide an evaluation form through your clinic for this plan. 95% of individuals will qualify, and 92% of people will bring home a baby. The price does vary by fertility practice because every fertility practice has asked for a different price to be paid to them. And that's how we build the model for what the plan costs. But it is a great financial security. Let me just walk you through one little bit about this plan. If you get pregnant and you have your baby on the very first try, you will pay too much. You should just know that going into it. You will have paid too much. I like to say, jump up and down, scream hallelujah that you had your baby and you did not have to suffer through 6 treatment cycles to get your money's worth of doctors telling you, we're so sorry, but it was not successful. And the heartache and the emotional cost that goes with each and every one of them. We need people to be successful on the very first try, because we need to be able to subsidize the cost of people that will take 6 treatment cycles. And we have had many that have gone through all 6 treatment cycles. If you get pregnant and have your baby after the 2nd cycle, you're about break even. 3rd cycle, 4th, 5th, and 6th, you've spent way too much. And if you need a refund, we've probably spent about $100,000 in your treatment, and we still give you 100% of your money back. So this plan was really designed to give you that complete security that you'll go home with a baby from the hospital, or you will have your money back. So we've encountered more and more times individuals that say, oh my gosh, Heidi, I love the assured refund plan, but I have some insurance coverage and we really want to use it. Or we've had some fertility practices that have said, we love your assured refund plan, but we're just not interested in offering that to our patients because they want you to pay them. So we created this year in 2021, the multi-egg lot refund plan for both of those scenarios. The multi-egg lot refund plan is very similar to the assured refund plan. It still guarantees you a baby. It's a flat cost of $30,000 and you'll receive up to 4 egg lots. You will need to pay your fertility practice separately for those fees and for all the treatment. We will supply all the eggs that you need. You get a 100% refund if you're not successful, and you'll get 50% if you leave the plan. I'm going to just caveat this with saying it's $30,000 for the multi-egg lot refund plan. If your fertility practice offers assured refund, you will find that the assured refund plan is typically only a few peanuts, not a whole lot more than the multi-egg lot refund plan. So definitely it's always going to be your best case scenario if you're at a clinic that does offer it. I saw it kind of pop up in the Q&A on my side vision, somebody saying, well, how do I know if my fertility clinic even offers assured refund or the multi-egg lot refund plan? You can contact our office. We'll let you know who offers it or even who in your area has that available for you. And if you'd like your clinic to offer it, Olivia and her sidekick, Becca, will be happy to reach out to your doctor's office to see if it's even a possibility.
All right, and then we also have a euploid quality guarantee. We know that some physicians are opting towards PGTA testing, or maybe you and your family are wanting to opt into PGTA testing as well. And we wanted to be able to offer some sort of guarantee for that as well. So this is an extra cost on top of the single or double egg lot plans, and it guarantees at least 1 or more euploid embryos in up to 3 egg lots.
So let me talk about the packages again, and then Olivia will go over the ones that don't include treatment. So the ones that are bundled together is the single cycle. It's the egg lot with the treatment services. You do get the guarantee for both the treatment and the eggs. We do guarantee a blastocyst with each of our egg lots. And assured refund plan, we have a live birth guarantee. It's 1 fee up to 6 egg lots. And all the treatment services, unlimited FETs, everything is included. It's 100% refund if you're unsuccessful. 95% will be approved. 92% will bring home a baby.
So let me walk you back over the packages that we offer, in which the cost of eggs is separate from the cost of treatment services. We have the single egg lot for $14,500. That includes 1 egg lot and the guarantee of 1 or more usable blastocysts. The double egg lot is $27,500. With this plan, you're getting 2 egg lots and a guarantee of at least 2 or more usable blastocysts. And then the multi-egg lot refund plan, that is a cost of $30,000. You get up to 4 egg lots, and that does come with the live birth guarantee and a 100% refund if you're unsuccessful. And as Heidi mentioned with the assured refund, 95% will be approved and 92% will bring home a baby.
So we happen to have, as part of our primary company, which is Generate Life Sciences, a company called Cord Blood Registry. And we're able to provide to you with every baby born through Donor Egg Bank USA, free newborn stem cell protection, which is cord blood and tissue processing. I'm really excited about this because when you're utilizing a donor, I think it's more important than ever to have the genetic material for your baby on ice. You don't have access to one whole side of that family for your baby. And what got me excited when I learned about this is the number of regenerative studies that's going on. I really believe that there will be a day that we're going to be curing a lot of our own disease, and we're going to be doing it through our stem cells. So this is a great gift that we can give you because we have this parent company that has this awesome company, and we wanted you to know about it and certainly consider storing your newborn stem cells. If you use us, you get it for free. If you use anyone else, I still encourage you to go down this direction. Put the investment into your baby. So just to sum up, I want to go through with you what were some of my common fears and what are some of the fears that I've heard from others. Will I love the baby? Absolutely, you will love the baby. It is very uncommon and extremely rare for someone not to bond with their baby. Can you carry this baby and be successful? I really wondered about this. I remember telling my doctor, I probably need a surrogate. I need a gestational carrier because I've had 2 miscarries. Obviously, I can't carry the baby. It's probably your eggs. Almost always the uterus is able to carry a baby. And that when you go to donor egg, it's usually the eggs are the problem, not the uterus. Will everyone know you used an egg donor? Not if you don't tell them. No one's going to know. And I found that even the people that I do have told, like my mother, continually forgets. She'll commonly say to me, oh, well, she gets that mannerism from your grandma or from someone. And I'm always looking at her going, we used an egg donor. So everyone forgets. Can you emotionally and physically do another cycle? Donor eggs are so successful. 61% clinical pregnancy rate, 50%, ongoing live birth rate per transfer. You can do it. Will you find a donor you like? With 300 donors on the database, more than 200 in Canada, you are definitely going to find someone that you like and will work for you. And can you afford it? With our assured refund plan, you can afford it. With our multi-egg lot refund plan, you can definitely afford it. You might have to stretch a little bit. We have financing available through CapEx-MD and Future Family and other programs. It is something we're stretching for because these are children that you will have for a lifetime, and it is a highly successful way to go about building your family. So I promised you some pictures. In fact, if you are a follower of us on Instagram, this photo went up live, I think this morning by our team. I ended up having twins. I had 2 embryos in the time that I did this. Day 3 was not uncommon. Blastocyst is the gold standard. But I had 2 day 3 embryos transferred. I was told that they were pretty crappy looking embryos and that the polar body wasn't where it was supposed to be. And basically my physician was prepping me for the disappointment because he was pretty confident I wasn't going to get pregnant. And lo and behold, my beta went off the charts. And then he freaked out that maybe I was having triplets with these 2 crappy looking embryos. But I did give birth. They are premature. Is a reason to only put back 1 embryo whenever possible. And I'm very grateful that both my children lived, made it, and they thrive today. So here are my children and my adopted son, who is truly the joy of my life. I like to tell people that we all have our own journey, and your journey is different from my journey. But what binds you and me together is the deep desire to be a parent and our willingness to persevere to make our dreams come true.
Okay, so we want to thank all of you from the bottom of our hearts for joining us tonight. If you are able to stick around, we will answer some of the questions we have received through the Q&A panel. And if you haven't already, please register on our website. It's completely for free. We do have the website listed here on this slide. And we also have case managers available right now until 9 p.m. Eastern time if you wanted to call in and ask your questions that way. So let's address the Q&A.
So I'll start with the first one. The question is, how long is the process after selecting a donor? So first of all, let me just share that the donors that you see on our database, they have already completed their cycle. Their eggs are frozen and they're ready to ship. Once you select your donor, you'll go ahead and sign contracts and you'll send in payment, and we ship those eggs within 2 weeks. Usually it's about from the time of selection to the actual timing of your transfer, you're probably about 30 to 60 days. Most fertility practices will wait until the eggs actually arrive in the lab, and then they'll go ahead and start your cycle. But it can happen very quickly.
So the next question is, how large is the availability of eggs from African American donors? Which is a great question. We really do pride ourselves in having a wonderfully diverse database of donors. And I can tell you that the percentage of different ethnicities is changing every day. Every day we have donors coming and going, but we do have a really wonderful wide range of diversity. And I can tell you that our case managers do an amazing job at helping you find this kind of donor that you are hoping for. And if there is something specific that you had in mind that you aren't seeing, definitely let your case manager know, and we can flag that for you and keep an eye out. And when someone does become available that does fit those desires, we will let you know.
Let me just add a little bit more to Olivia's question, because I was in the database earlier today. African American donors, I mean, what is going on? But in the last 9 months have been in huge demand. As soon as we put them on the database, they're flying off. We have put out a call to all the fertility practices that were in great need of African American donors. The database is a little on the lower side than normal for these donors. I was talking to the donor team actually earlier today. I know some went up over the Friday, and I think it was Monday, a few more went up. But keep your eye open. And as Olivia said, work with the case manager, let them know so that they can help monitor the database for you to make sure that you're getting first shot at the African American donors as they come online. So Olivia, I just wanted to add that because I had just seen it this morning. So, so let me add, what is the difference between 6 transfer cycles and frozen embryo transfer cycles unlimited? So, this is such a great question, and I appreciate it because, we talk about all these things, and sometimes if you haven't gone through the process, you actually don't know. So a transfer cycle is typically when they're actually warming the eggs for the very first time. They are inseminating those eggs, utilizing ICSI with your sperm, and then they are culturing that embryo to the blastocyst stage. And that's what's referred to as one of the 6 transfer cycles. Now, inevitably, we know that 69% of the time, there'll be embryos that are like left over. They're only going to transfer 1, maybe 2 maximum. But you'll have these frozen blastocysts that they'll go ahead and freeze and cryopreserve for the future. Those will be transferred in what's called a frozen embryo transfer cycle. So we say unlimited because we don't know how many frozen embryos you're going to have. You might have 0 on that first egg warming, and you may have 6 or 7. We have both situations. Typically, we average, I think it's 2.45 blastocysts per cycle is what the average is, but it all depends. Many cycles, 30%, 31% of cycles will only have the blastocyst available for just that transfer.
So the next question is the euploid guarantee rider not available for the assured refund plan? And I can tell you that while it's not, we aren't huge proponents of PGTA testing with frozen donor egg. And especially with the assured refund plan, you're getting up to 6 treatment cycles and those unlimited FETs to achieve a pregnancy. So utilizing PGTA is not as necessary, I should say, with the assured refund plan when you're already getting so many opportunities for a good quality embryo. I will say that you are able to do PGTA testing with the assured refund plan, but that would be an entirely separate cost that you pay with your clinic. And that's something that we would discuss with your laboratory to make sure that everything's in the right place and that we're using a good quality laboratory for the PGTA testing that we're confident in.
So somebody asked that they understand that every clinic charges differently. What is the average cost of the range for the 100% assured refund plan? I would really encourage you just reach out to the team, let them know where you are and what clinic near you offers this 100% assured refund plan, and they'll just give you the pricing. We'll have a full financial guide that will be available for you.
Okay. So we have a couple of questions about the euploid or PGTA testing. One question is with the euploid package, what was the acronym used? And I threw out that word PGTA testing, and I know that can be kind of confusing, but that stands for pre-implantation genetic testing. And none of the packages do include the cost of PGTA testing with that package itself. If you choose to purchase the euploid rider, again, you're purchasing the up to 3 egg lots, but the cost of PGTA itself is still going to be paid to your laboratory, your clinic. Let's see.
Yeah, so let me just add in, because the next question also has to deal with what you Olivia just shared, but a little more detail about, do the packages include that euploid testing, or does the euploid package include the testing? It does not. What the euploid package does is it gives you the ability to get additional eggs should you not have a euploid embryo. So let me help break that down for you. As Olivia said, PGTA, the A stands for aneuploidy. So you'll hear these words, aneuploidy, aneuploidy. Aneuploidy means that the blastocyst or the embryo is chromosomally abnormal. Euploidy means that the embryo is normal and will be more likely to implant. The great thing is, and I think we focus on this a lot if you've gone through the IVF process, because as we've gotten older, or perhaps if you have premature ovarian failure, you're having a lot of miscarries, and those miscarries are being produced by these embryos that are aneuploid. They're chromosomally abnormal. But the great thing about utilizing a donor, which is why we're not proponents of PGTA, is because these donors' eggs are really vibrant and they're very likely to produce a euploid embryo. Talk to your physician. There are sometimes, physicians will definitely refer you for PGTA, and you should always follow the guidance of what your physician thinks is best for you and your circumstances. And that's why we have the euploid package. We're not huge proponents, but we also know that sometimes it is necessary, or a physician has made the determination to move forward in this direction for you.
All right, so next question is, what is the success rate between frozen eggs versus live eggs? And Heidi might have more specific numbers, I'm not sure, but I can assure you that with the latest,
let me just add, it is equivalent.
Yeah, go for it.
It is equivalent. And if you look at the SART data, you will see that our frozen eggs are outperforming the SART data for frozen eggs.
There you go. So I'll take the next question then. So if I caught that correctly, I should explain to my partner that we have a 50% chance of having a baby with IVF, referring to the success rates. So I'll specify that with not just with IVF, but with frozen donor egg. There is just above a 50% chance of bringing home a live baby using frozen donor egg. That is correct.
And then I'm going to just chime in there and say this. When I was 30, I would have thought I would have had a baby too. And so the success rates are great, but remember, you're looking at just 1%, because I never thought I would do 11 cycles of IVF and frozen embryo transfers and 2 miscarries and do an adoption. I never thought that about me, which is why I'm a proponent of the assured refund plan. You know, the stats are great when you're just looking at stats, but we're each individual, and no one can guarantee it will be you or it will be me or anyone else that will be the one bringing home that baby. Will you get another egg lot if you do not get a blastocyst? Yes, we will replace the cycle, unless it is a male factor case, in which we do require at least 1 million sperm in the raw ejaculate on the day of the insemination.
Our egg lots guaranteed to be from the same donor. So each and every egg lot is coming from the one same donor. We don't have any egg lots where they're coming from a combination of one or more donors. As I mentioned, you know, when the eggs from a donor are retrieved, we break them up into egg lots, just depending on how many were in the retrieval. And all of those eggs from an egg lot that you see on our database are from that same donor.
Great. I'm going to take 2 of these, Olivia. I'm going to pop up and say, how can one identify the intellectual potential on the donor database? And it's an excellent question. Look to the motivation statements. Look to kind of what she says she's good at. If she says that she's very scientifically minded and loves to do different, you know, science type projects, that tells you something about her, but maybe she's a hairdresser. So, you know, just, you got to almost like read through it a little bit and say, is there greater potential here than what the donor is actually exhibiting? Because we don't always know what her life circumstances and why she is a hairdresser or something like that. So that's the only thing I'm saying when I think the intellectual potential. And then someone asked, you talked about Canadian donor. When I go on my login, they are all American. Yes. Okay, so let me clarify this. When we don't bring any donors in from Canada. So we only will cycle a donor in a country in which it's legal to do so. And there are regulations that can be followed. We follow FDA, Food and Drug Administration regulations for every single donor. Every donor is screened in the same way. They go through genetic review. They go through their infectious disease testing, their psychological assessment. It's all done the same way. But when we talk about Canada, we ship eggs from the United States to Canada across the border in accordance with Health Canada guidelines and in accordance with the Health Canada regulations.
So what is the advantage of using Donor Egg Bank USA versus other donation sites? Oh, how I could go on. We have one of the largest and most diverse donor databases out there. So you can be rest assured that you're getting a very large, diverse options from donors to choose from. We also are quality control freaks. So you can rest assured that we are really working with our retrieval sites so closely to make sure that you're only getting the best of the best eggs out there. We also have an incredible team of dedicated case managers who really work so closely with you and your family to make sure that you're fully informed about the whole process of using Donor Egg Bank USA, and really helping you choose the best donor that's the best fit for you. And then we also are the only egg bank that offers the assured refund plan. And as Heidi has mentioned, this is really just the gold standard out there of your financial options, just really giving you peace of mind after a good number of you have already likely gone through a lot of difficulty with IVF and trying to conceive. The Assured Refund program really is just a wonderful opportunity to have that breath of fresh air and that guarantee of a live birth or 100% refund. Anything else you want to add, Heidi?
Oh my gosh, Olivia, you nailed it. Perfect. So what rules have recently changed related to egg donation for people in Canada? Well, a lot of rules. The rules came into effect on February 4th of 2020. It really aligned quite nicely, thankfully, with the Food and Drug Administration for infectious disease testing. But the rules really impacted every component of the process, right down to how the straws are labeled. We have reviewed the rules. We've gone over them at length. We have a regular quality assurance and regulatory team of, I think it's over 10 people right now. So we are truly on top of it. And I can assure you that we're meeting all the guidelines.
In regards to genetic testing, do candidates who are carriers excluded? So we do have a set list of genetic disorders, and if intended donors are carriers of those disorders, they would not be eligible. But when there are specific traits that donors are carriers of that don't necessarily exclude them from being a donor, those genetic screening information is included in the donor information that your clinic is receiving. So we really encourage you to work with your physician to take a look at that genetic screening results from your chosen donor and see if it's a good candidate with the screening results coming from the sperm.
The next question is, for the psychological screening of the donors, is there counseling available for them to be a donor, or is there some type of a mental health test for their health history? Yes, there are. Actually, it's both. The donors go through, there are two well-recognized tests called an MMPI or PAI. They're administered that test, and then it's read by a psychologist to determine if they're fit to move forward. And they also get counseling on what it means to be a donor and what the requirements are to move forward. Not the things that they need to do, but just helping them understand that they're creating a life, and they have a responsibility to report back medical changes in their health for a lifetime. So just helping that donor, that young woman, make the best decision.
Are any donors open to connecting with the donor-conceived child upon age 18? So yes, we do have some donors who have opted into being contacted once the donor-conceived child has reached 18. That you'll be able to see whether or not the donor is open to that on their profile. But not every single donor has opted into that.
I'll take the next two questions. The first one is, how do you ship the eggs? Eggs are shipped FedEx, Priority Express. They go overnight and are in your clinic by 10 a.m. the next day. We like to allow up to 2 weeks because the eggs are located in the fertility practice in which the donor had her retrieval. And we want the embryologist to take their time in packing the eggs and to do it at a time that they're not busy, so they can do a great quality job. And then someone else has mentioned, diversity was mentioned as a benefit, but in reviewing the registry, many of the donors are from a specific region, for example, the Ukraine. And why is this? Well, we're really excited that we have been working with a top-notch program in the Ukraine, on all of the requirements and FDA and everything for a while now. In fact, I was actually with that program just a few weeks ago. Very, very impressive program, beautiful donors. And we are able to now access those donors in order to build some of the Caucasian options on the database. We are continue to look for other areas, both here in the United States and abroad, that will continue to broaden the ethnicities that we have access to on the database.
Is there any prep that needs to be done before the transfer? For example, any medications that need to be taken for a period of time beforehand? So that's a great question. The answer is yes. You will work with your physician at your IVF clinic to take the medications necessary to prepare your uterus for the transfer. We typically work with your nursing coordinators and your physicians along with the timing of the egg shipment to make sure that everything is happening according to plan, that the eggs aren't getting there too late, not in time for the transfer to be made, or getting there before you're ready. So we really do work very closely with their clinic to make sure that the timing is appropriate for when you and your uterus are ready to for the transfer.
So I'm going to take the next two questions, but Olivia, I just have to chime in on that one.
Mm-hmm.
So if you've gone through the IVF process, oh my gosh, going through donor egg is like a walk in the park. I always like to tell people the medications you're going to take is estrogen and then progesterone. And I feel like estrogen should have street value, honestly. I have never been so happy as the time that I took the estrogen to get my uterine lining set up. So it is not a lot of injections. It's super easy and it's actually quite nice. You will be feeling very happy. So are there certain parameters that must be met in terms of the sperm quality in order to qualify for the blastocyst guarantee? Yes. The sperm must be at least 1 million sperm in the raw ejaculate on the day of insemination. We want the sperm to be good. If it is surgical sperm, then we will work with your clinic, but we will not necessarily guarantee the blastocyst unless we have reason to believe that possibly it could have be an egg issue in which that blastocyst did not produce. We utilize our sister data to usually make those decisions, and we ensure that all the donors on our database we feel very confident in. So let me go on and to the next question, which is, what is the % risk of egg lot destruction during shipping and who takes that risk? We will take that risk. And we have lost over, we've probably shipped probably 12,000 shipments, and we've lost, I think it is 3 egg lots in 10 years.
Are there more donors available on the site to look through after you've purchased a plan? Or is it the same as what you can see just from creating a regular login right now, AKA the unpaid way? So there is no payment whatsoever for taking a look at the full database of our donors. When you log in for the first, when you register for the first time, you'll be able to see the full registry. And then once you're contacted by one of our case managers, typically within 24 hours, they will open up a little bit more of a thorough look at each of the donors. But you never have to pay any money to take a look at the full database.
How many embryos do we get to implant the first time? That is a decision between you and your doctor, but the vast majority of fertility practices do what's called ESET, meaning only 1 embryo will be transferred.
Let's see. How long does it take between 2 attempts in the multiple cycle or assured refund plan to restart a cycle? So that's a great question, and it very much depends on how many embryos are successful embryos come from that cycle. So for example, say in your first cycle with the multi-egg lot or the assured refund plan, you get 3 good embryos. You put back 1 embryo and the other 2 are frozen. If that first embryo transfer doesn't result in a pregnancy, then we'll use one of those 2 frozen embryos. And then if those also don't work, then you'll go on to your next egg lot. So that's kind of how it works with each egg lot that you're getting with those multiple cycle opportunities. We do work very closely with your clinic to make sure that we are getting the results of those cycles, to make sure that granting your next cycle, if there is a failed cycle, granting you the next egg lot happens as quickly as possible.
Somebody asked the question, how do we have confidence in the characteristics presented on your website about the donor eggs in the database? The donor self-reports those characteristics and that information that you find on the website. It is self-reported by the donor. The donor does meet with a psychologist. The psychologist does all the testing. The donor meets with her nurse. You know, if you've been through an IVF cycle, she'll meet with her nurse, you know, almost every day of that cycle. There's a lot the donor that goes through, and the clinics, I think, do a great job in determining who is not a good candidate to be an egg donor. As well as if the donor says she weighs 120 and the nurse is like weighing her in the office and she's really 130, the nurse is going to update that profile to the accurate information.
Does Donor Egg Bank USA divulge how long the eggs have been frozen? So we do not share that information openly on the donor's profile, but I can assure you that there is no scientific evidence that frozen donor eggs are of lesser quality with the length of time that they've been frozen.
So somebody asked the question, which clinics offer the baby within 4 cycles or your money back? That's our multi-egg lot refund plan that you're referring to. And you can get that plan at most clinics in the United States. And we have a growing number in Canada. But our best plan is the assured refund plan. It is the plan that we launched with. So most practices that we've worked with for some time offer the assured refund plan.
Is the average thaw rate for donor eggs different from clinic to clinic? So we work very closely, our embryology team works very closely with the embryology team at your clinics to make sure that they are fully trained and fully equipped to treat the eggs with the utmost care and result with the best thaws and transfers. If, like I said, we are quality control freaks, so if we ever notice that a clinic might be underperforming to our standards, we get in touch with them right away and make sure that everyone is adequately trained and prepared to handle these eggs with the utmost care because, you know, they're very important to all of us.
I'll say, let me chime in there. Every donor that you see on our database is available for selection in our assured refund plan or a multi-egg lot refund plan. Every clinic we work with can work with the multi-egg lot refund plan and the assured refund plan. We take 100% of the financial risk in those plans. So if we're not confident in that clinic, we wouldn't be offering those plans. So we have to be confident in the eggs on the website. We have to be confident in the clinic that they know how to thaw eggs in order to take all of that financial risk on those plans. So hopefully our confidence can give you confidence. And then somebody also mentioned that their IVF cycle never made it past day 5 to blastocyst. I would like to invite you to reach out to the team tomorrow and ask specifically to get in touch with me. We are participating in a very cool study right now that is taking a deeper look at male factor. And I think you might be a great candidate to participate in that study and learn a little bit more of what could be happening in which the blastocyst is not being achieved.
How do you confirm family history? So as Heidi mentioned, the donor's information is fully self-reported. But when the nurse or the donor coordinator is doing the intake with the intended donor, we really are making sure that the family history is very thorough. If it's looking a little, not deep enough or surface level, we do want to make sure that we're getting as much information as possible from a very wide branch of the family history to make sure that there isn't anything or any outlying factors that could make this donor's family history an issue.
And we also have genetic counselors and many genetic counselors that screen the donors and go through that family history in detail and help that donor go back to, let's say, an aunt to better understand what type of cancer might have been in the history. So I think we do a great job really digging down into that family medical history to make sure that we have a complete medical history. But as Olivia just said, we are dependent upon the donor, herself to report. The next question is, I'm 41. We got pregnant on our own earlier this year, but I miscarried in week 9. We've also had one failed IVF attempt. If we use a donor egg, would there be anything else with age that would prevent us from having a successful pregnancy? I just want to tell you that you represent probably 80% of the people we talk to every day. It's most likely your eggs at the age of 41 that is causing the miscarry, that's causing the failed IVF attempt. And I feel confident that with donor eggs, you've got a great shot at being a mom or a dad. Well, obviously you're female if you got pregnant, but a mom and a dad.
Where did the donors cycle? Are the eggs all retrieved and frozen in the same method in case they're cycled at different facilities? So we work with a variety of retrieval clinics across the US and in a couple international locations. And all of these retrieval facilities are following these same very strict quality protocols across the board. So they are all retrieved and frozen in the same method. And we are making sure, as I said, that each of those retrieval sites are operating up to our standards and treating the donors with the care that they deserve, and the retrievals, the eggs with the care that they deserve as well.
I'll take the next 2 questions. What is the cost of shipping frozen eggs? $570. It is included in the multi-egg lot refund and the assured refund plans. And then the question is, if genetic testing is performed on all your donors, does that eliminate the need for genetic testing on the embryo? These are really 2 different things. The genetic testing performed on the donor is to see what she's a carrier of, what diseases she is a carrier for. And if she is a carrier, you can still move forward with her, but it is highly recommended that the sperm source be tested for those same carrier types to just make sure there's not a match. Testing on the embryo is usually done to determine if the chromosomes are normal, or if the sperm source is a carrier of the same thing that the donor is a carrier, then you'll almost always be told to choose a new donor. But if you choose to move forward, then you would have to do genetic testing on the embryo to determine that there was an embryo that would not have the actual disease. And that is very expensive, which is why you're typically told to choose a new donor.
Can embryos made using frozen eggs be frozen? So it's a great question. And the answer is yes, absolutely. In fact, a good number of clinics do opt into doing freeze all cycles once embryos are created. In this case, the eggs are thawed, they're inseminated with your sperm, and then they'll be frozen. And really, part of the reasoning for that is to allow for the timing of transfer to be a little bit more flexible. Again, not all clinics do this, and it really is dependent upon your work with your physician and your nurse coordinator. But it is sometimes the case that the embryos created are frozen and then kept for a later transfer date that's more convenient for you.
Somebody asked, is there a decreased success rate with frozen sperm and frozen eggs? because they will be doing a cycle with frozen sperm. No, it's about the same as if you were using fresh sperm. However, and that's why I went ahead to answer this one, we have seen cases if the frozen sperm vial is not being fully thawed and instead the sperm is being scraped off the top, we do have a decreased rate of success utilizing frozen eggs.
How large is the donor database? Any issues in bringing more donors due to COVID? So another great question. Currently, our donor database sits at a little over 300 available donors. Before COVID began, we were inching over an average of about 400. And of course, retrievals did slow down because of COVID for safety concerns. But I can assure you, we are slowly inching up and getting more and more donors all the time.
I'm going to tackle the question of somebody asking about the anonymity level of the donor, and can children born through one's donor eggs find one another when they become 18, or is it confidential? It is confidential. If you choose an ID released donor, that means that your child at the age of 18 would be able to ask for the information on the donor, which would then be released to that child. We will not release any information regarding any other children born from that donor. But there are programs such as the donor sibling registry that you can find online, that you can register and find other siblings in that way, but it is self-registry and self-reported.
Do you have any donors with Indian ethnicity? I was unable to see any on your database. Please help me find an Indian donor. So we would love to help you find an Indian donor, and we understand that sometimes they are hard to come by. But as I mentioned before, we really want to help make sure that you find the donor of your choice. So definitely, I would recommend registering on our website and getting in touch with one of our case managers, and they can help you look through the database and certainly keep an eye out if anyone does come up that suits your desires.
Let me just add a little bit to that. You know, it is heartbreaking that Indian donors culturally are very hard to find. They don't tend to donate. What typically will happen is you will look for your donor for a period of time, and then you start to settle. I hate to tell you that, but typically people start to settle. We specifically look for Latina donors that have a very, you know, kind of an Indian look through the eyes, through the nose. So it might be something that you'll need to do is look at the Latinas, look at the multiracial, and try to identify a donor that will have the closest look that will match you. But I wish we had the magic wand to make more Indian donors appear. I also want to answer the question that says, will I pass on any of my genes or personality traits to the baby, or is it 100% from the egg donor? If you are the one that will carry the pregnancy, there is a concept called epigenetics. Your genes will not pass. I mean, let's just, biologically, there's no way for that to happen. But epigenetics basically says that the gestational womb will help determine which genes in the baby are expressed. And that will impact the personality of your baby and can also impact, you know, some of the genetics of your baby and what is actually expressed. So you will have an impact on your baby if you carry the pregnancy.
Any guarantee for purchasing eggs for family balancing on specific gender? So we do not offer any guarantee programs for specific genders or family balancing. If you know the resulting quality or usable embryos from an egg lot, if none of them are the gender of your hopes or of your choice, it's really up to you if you choose to transfer or not. But there is no backup guarantee if the embryos do not result in the gender of your choice.
For eggs shipped into Canada, there are no additional taxes or fees that you have to pay other than just the shipping. With the assured refund and the multi-egg lot refund plans, we cover that shipping for you.
If there are not enough eggs available from a single donor, can we get egg lots for multiple donors? And is the blastocyst guarantee still applicable? So there will never be a case in which there are less than 5 to 8 eggs available from a donor. The egg lots that you see of 5 to 8 eggs come as such. So there's not really any such thing as an egg lot having less than 5 and you combine it with another donor's egg lot that also has less than 5. If you are wanting eggs from multiple donors, that's a situation where you could look at the double egg lot plan or any of the multi egg lot or assured refund plans in which you can choose egg lots from different donors.
The question is, are most of the Caucasian donors from Europe, and are they shipped from Europe to the United States to be fertilized? No, that's not the case. The majority of our donors are here from the United States. But we do have some eggs coming in from Europe. They are bulk shipped to us in California. They're fully reviewed by our quality assurance team. And then we release them to the database to be shipped from California to your location.
I'm seeing a couple questions come through about a list of clinics that we pull donors from. And essentially, we have a list of retrieval sites, some of which also are clinics where we have patients who choose donors. But we don't have a list somewhere available of our different retrieval sites. But as far as a list of clinics that you can work with and that offer the different guarantee programs, on our website, we do have a location. You can type in your location and it will tell you the clinics nearby that we do work with. To find out specifically which programs that clinic offers, you can certainly contact us and we'll let you know. And if you are working with a clinic or considering a clinic that does not have a partnership with us yet, absolutely let us know and we would be happy to reach out to them and see if we can work together.
Somebody asked, is the one profile picture of the donor all that is given? Typically the donors have anywhere between 5 and 10 photos available. The vast majority have a picture of them as they were a baby or a young child, as well as adult aged photos. So talk with a member of the team if you're not finding where to click on the database in order to see all those photos, and anyone can help you with that when you're in the website to be able to see all the photos. I should also add this. One thing you get with Donor Egg Bank USA as well is when you select your donor, everything that you see, you can download. We want you to download it and keep it for you. I can't tell you how many times I've had to go back and actually pull the profile of my donor to answer questions. For example, just recently, my pediatrician for my daughter asked, well, when did I get my first period? I was a little surprised by that. I said, it's not really relevant. Let me find out when that was for the donor. So that's the medical information I'm still pulling from my profile up until this day.
So I'm seeing a question about specific pricing for the different programs. And then also, is the cost different for 6 eggs versus 8 eggs? So I'll just say that if you do have questions about specific pricing, I highly encourage you either to give the phone number here a call and we can let you know about specific pricing for your clinic, or talk with your case manager after you've registered. But there is no price differences when it comes to the number of eggs in an egg lot.
Somebody asked, the donor has a supplemental fee of $750. What does that mean? Very few donors on our database will have a supplemental fee. And if they do, it means that we worked with a donor agency to source that donor, and we had to pay the donor agency a fee. Either the fee is for that, or it could be that the donor had to travel for her retrieval with that agency. And how we determine what that fee is we take the extra costs we had to spend, we divide it up amongst the egg lots we get, and we just pass that directly back on through onto the client. Our use of those agencies is usually to try to find some of the harder to find donors, such as Asian donors. You'll see more likely will have that fee.
What is the method of retrieval? So I'll just be brief about this, but essentially the donors undergo, they take some medications to prepare their ovaries to for retrieval. Essentially, we're stimulating their ovaries and following the cycle process normally to make sure that there's a good number of eggs to be retrieved. Once they are retrieved, we freeze the eggs and they are stored on site at the retrieval location. So it's something unique to Donor Egg Bank USA is that we are not shipping the eggs that we've retrieved to a freezing facility somewhere that's localized. The eggs will always stay where they're retrieved. So we're really minimizing the amount of times that these eggs are packaged and shipped.
With the exception if they come in from international, they are stored in California for convenience purposes. Is there a way to tell if someone is proven donor on the website? Yes, there is a filter that you can choose for proven. And then someone asked, if you get more than one embryo, can you select the sex? You can select the sex on any of those blastocysts, but you may not do so in the assured refund or the multi-egg lot refund plans. Otherwise, you are welcome to choose which embryo you put back first.
One question, where can I reach for, or how do I contact my case manager? So the process of that is once you go on our website and you register, and registering really just looks like entering in your basic contact information. Once you do that, our case management team is made aware that you've registered, and they will reach out to you to inform you of all the different program offerings and start your process.
Somebody says they're single and in their 40s. Can we recommend a sperm bank? Absolutely. We would recommend our sister company, which is California Cryobank. They are the largest sperm bank in the United States and have been around for over 40 years. And then somebody else says that they want to have two children, would like them to be full siblings. Would we recommend a double egg lot? Absolutely, would recommend that you do the double egg lot. Talk with your case manager so that you are choosing a donor that has multiple egg lots available to you to ensure that you can have genetic siblings.
So one question, what determines egg quality and what determines embryo quality? So this is really a very specific embryology question here, but as I mentioned, we do work very closely with our retrieval sites and with your lab team at your clinic to make sure we're all on the same page about what does quality mean and what is the utmost quality. What determines egg quality really very much depends on the growth status of the egg when it's retrieved. And then once it's thawed, we really are making sure that the egg thaws properly before we feel good about inseminating it. Same with embryo quality. It's very much up to your embryologist when they are determining whether or not the embryo is of good enough quality for transfer. But our embryology team works closely with them to, again, make sure we're all on the same page of what quality does mean.
Somebody asked, can they return an egg lot or release the donor after selection? I'm a big encourager to say, when you see a donor you like, select her. Yes, you can go ahead and cancel that selection within a few days' time. Once you make payment, you sign the contracts, and we're ready to move forward. Typically, we've already started that shipping process. At that point, it is a no return policy. But I would much rather you select a donor that you think you love and the next day change your mind versus say, I think I'll wait, and then the next day the donor is gone. Somebody's asking about the new policy in Quebec, Canada. It's interesting because our Quebec program just reached out to us yesterday. So I have not read the new policy regarding the 2 IVF cycle coverage by the government health insurance. I will definitely reach out to our program to talk about it. You're asking if you're able to get a reduction since the clinic will be able to get refund for the lab procedure. Let us work with the clinics in Quebec to determine the best process forward. Typically the choice for you is going to be to do the single egg lot or the multi egg lot refund plan, in which just the eggs are provided and none of the treatment or the lab fees are covered. That would then be covered by your health insurance.
One question, I didn't understand why clients in the Assured Refund Program can't choose the sex if they're doing testing and both sexes are available in the good embryos. So that's a good question and an important clarification that with the Assured Refund Plan, we do require that you use any of the excess available good quality embryos for transfer before you get your next egg lot. So if you're really hoping for a girl and you get 2 good embryos from an egg lot, one's a girl, one's a boy, you transfer that girl and it doesn't result in a pregnancy, we do require that, you know, those good excess embryos, the boy in this case, are transferred for an attempted pregnancy before you would be given, before you'd be granted your next egg lot in the plan.
So I just want to, somebody commented after I shared that, you know, that they saw this donor and just felt an immediate connection. I'm almost in tears. I am so happy. That is what you're looking for. I mean, that I remember when I went through all the donors on the database. Now, mind you, when I went through, there were only like 38 donors and we looked at every single one of them. It didn't matter what race they were. We looked at them all. But the donor that struck me, it wasn't her you know, her background, it wasn't her family, it was what she wrote in her motivational statement. And she said that she loved a great book on a rainy day, and it just hit me. And it's like, oh my gosh, I felt that connection with her. And that connection is what you're looking for, is to feel that it felt right. So definitely, if you have that feeling, jump on it. You know, take the chance to at least select the donor, and then you can always change your mind after you think more about it later. But that makes me very happy to see that. I also would just share off the cuff, because I just thought about it. When you're selecting the donor as well, you know, select for your weaknesses too. So think about the things that you wish that you could get a little genetic improvement on. You know, I wish that I knew how to sing and that I could sing and carry a tune, and I can't. And so it was something I chose in my donor. My donor put that she was really good at singing, and it really warms my heart to every time my daughter takes a shower, she sings at the top of her lungs in the shower. And I'm like, oh my gosh, like she got the 2.0. She's a much better me. And I like that too. Is the pricing higher for Asian donors like on other sites? No, it's not higher. We charge the same for every egg donor on the website. It's your choice. If we had to use an agency to help find that donor, you'll see that supplemental fee. But otherwise, all the egg lots are the same price. The egg lot that has 8 eggs in it is the same price as the egg lot that has 5 eggs in it. You know, I really recommend that if you find 2 donors you love and one has 7 eggs and one has 8 and you love them equally, maybe you do go with the one with 8. But you are choosing the genetic material of your child. So let your heart help drive that decision. Feel that connection, and you'll feel more confident in your decision overall. So I think we've come to all of the questions. I hope we answered at least the vast majority of these as we went through. And it's been wonderful to spend this time with you. We do have individuals available answering the phone up until 9 o'clock Eastern Standard Time tonight. Feel free to email us, give us a call, and the team would love to work with you. I'm so proud of the team that we have in place. We've got just some unbelievable women that will hold your hand through the whole process, and we cheer you on. We want you to be successful, and it's really our joy to work with you and be a part of your journey.
Thank you everyone so much for joining us. We really appreciate you taking the time to do so.
Thank you. Everybody have a great night, and we will talk with you this week. Take care.
Bye-bye.